what about a patient with an L1196M mutation while on Loratinib? So this is a patient with stage 4 disease harboring an ALK fusion that developed a resistance alteration known as L1196M while on Loratinib. What does this mutation mean for ALK to show up on a liquid biopsy?
One question is the mutation present in the liquid biopsy at the time of disease progression, or is only present in the liquid biopsy? Because we are learning how to monitor patients with liquid biopsy, but we still rely on CT scans to change therapy, because we certainly don't know what these mutations mean, and also depends on the allele frequency. How frequent are in the liquid biopsy? I monitor many of my young women with liquid biopsy, and I don't act. At least I have evidence of disease progression, because there is no data out there that suggests that I should do something for something that I found in blood. Why? Because it can be a very tiny little resistant mechanism that doesn't have a clinical significance. And I don't want to take my patient on a very well-tolerated therapy for something that I have very minimal to known data about it without disease progression. So I guess the question is do we have disease progression or not?
Yeah, I totally agree with Dr. Florez. There are clinical trials ongoing these days. Also in my institution, we have a clinical trial where we act on the liquid biopsy data, but that is in a clinical trial setting. That is different from clinical practice.
I also agree. Yeah. So the clinical status is more important than, I mean, it's wonderful to monitor dynamics of mutations, things like that. But the clinical status, as Dr. Florez and Hirsch mentioned, I think more important.
Yes, absolutely. Thank you, all of you, for that comment. I would also just mention, I think, as you know, the question wasn't very clear on whether there is true progression or not. But if there is, then obviously there's some data that's coming out that there may be compound mutations when patients are on Loratinib. And so again, just a plug for all patients and caregivers on the call that, please consider enrolling on clinical trials if they are available. Talk to your treating physician to see there are new compounds coming up with the ALK, like 4th generation ALK inhibitors. So if that's a particular situation of progression, then I would definitely encourage you to discuss clinical trials for new compounds with your physician.
It looks like there's a follow-up for that patient that had stage 4 ALK fusion with progression on Loratinib. And the patient did confirm that, yes, unfortunately, there is disease progression. And this L1196M showed up on the liquid biopsy. So I think that the answer still is the same, that this may be a compound alteration, and looking for clinical trials in this setting is very, very reasonable. Obviously, I turn it over to the panelists to give their final thoughts on this question.
I agree with that. Also, I know they said they're sure there's progression, but how much progression? But I think a clinical trial is wise in this case. If that is not possible, there's other treatment options outside of clinical trials as well.
Yeah. Sorry. Go ahead, Dr. Hirsch.
No. I agree with this statement. It depends. It depends on the situation also. But these patients seem to have progressive disease on Loratinib, so look for a clinical trial.
Yeah, I agree. The only thing I would add is that I have to go back to the heat map that Dr. Hirsch showed to us in terms of sensitivity, resistance, and if I don't just remember off the top of my head, L1196M is sensitive to Loratinib or not. But if it's still sensitive, at least on the panel, understanding potential other mechanisms of resistance can be helpful. Perhaps tissue biopsy, things like that. But again, I don't remember this is resistant to Loratinib or not. I will just put it out there that sometimes because resistant mechanisms can happen in multiple. Sometimes people can have multiple mechanisms of resistance. So we have to just think a little bit about this particular mutation and decide what to do, I think.